This is the Art Beauty Podcast where we are always reaching for truth and beauty. Remember, the people and the brands on the show are not paying to be here, so we get to ask them those tough questions you want answered because you deserve to be informed so you can make the best choices for yourself. With that said, I'm Amber, and today my fabulous co-host is Dr. Ryan Neinstein. He is a board-certified plastic surgeon here in New York City. All he does is bodies, and all I do is Google his Instagram because it is insane. Before we get into all things today, we're going to be talking a little bit about tummy tucks, the mommy makeover, reverse tummy tucks. But before we get into that, welcome to the show, Dr. Neinstein. Thanks for being here.
Amber, thank you so much for having me. I'm so excited to be here, and I can't wait to jump right into it.
Yes. And you know what? We got to kick this off. Happy New Year, everybody, right? I mean, here we are, 2024. Whoever thought we would make it? Ugh. Do you have any resolutions for the new year, Dr. Neinstein?
No, I don't make New Year's resolutions because, always advancing, always growing, always learning. I don't have to, set the clock at a certain date. It's just a thing I do each and every day.
I love that. I feel like I set my clock at my birthday. So not necessarily like New Year's, but here's a crazy thing. My husband's birthday is New Year's Eve. So for him, I
Really?
feel like it's kind of a no-brainer. But
I don't change my goals, but
yeah,
yearly, but I do kind of a personal evaluation yearly and then a personal evaluation decade-wise. Because most people, I think it was Bill Gates who said most people overestimate what they can do in a year, but they underestimate what they can do in a decade. So you need to have a different lens by which you evaluate yourself. Yearly, you're probably going to feel let down because you couldn't in a year do as much as you could, say, over a decade. So I like to look at things in the short and the long to give a better perspective, but the move forward goals, initiatives, imperatives stay the same day in, day out.
Well, I got to say, I've been following your career, not quite for a decade, but for many, many years. And I have to say, I feel like of all of the body plastic surgery before and afters, I think I'm the most blown away by yours. So we have like, I want to talk today kind of on the tummy tuck. I feel like there's so many different names for that. Some of it is the mommy makeover, which I know is more than a tummy tuck. People think of plastic, liposuction, I'd like you to kind of go through what this is, and let's just start with this. What is a tummy tuck?
So I'm definitely gonna get into that. But what I want to specifically talk about what you said before about how you think, and you're watching over years, something has gotten so good, outstanding, quite an outlier. The ocean between good and great is vast, and that's all in the details. So if you pick one operation or few, whatever you in life, you pick a few things to focus on, but then you really focus on it. And I'm talking like all in 24/7 for a decade. So for me, tummy tucks and then, the accoutrements, the mommy makeover that go with it has been, at the center of my essentially personally and professional life. And like all compound interest, if we think about basic investing philosophy, it's small, like big things happen in small changes. Like it's small. So like literally every month we are making tiny adjustments to our tummy tucks. And then when you do this over a decade, like the difference between a 7 out of 10 and a 9.5 out of 10 is a decade of literally ruining your life trying to get into the details. And I'm happy to do it, and I'm glad I did it, and we'll never stop doing it. But it is literally, no one comes up with something overnight that makes an operation better. You have to slowly move it up 1% at a time, year over year. And it has to be an obsession. And the best part about it is the patients just get all the benefit, and that reciprocity is, they pay it back to you in the sense that they just make you feel great for all the work you put in.
Well, on that though, it's very interesting because do you find, as a plastic surgeon, I'm going to tell you, as a consumer these days, I look at plastic surgery and it's while you can be a general plastic surgeon, I really look for those specialties, right? So you want to go to a guy who only does rhinoplasties if you're getting your nose done. You want
Correct.
a guy to go to a guy who only does facelifts. That's why I wanted to bring you on for our kick-ass first episode of the year, because I feel like you're the guy you go to if you want something done from, tits to
I'm
knees.
neck,
I mean,
yeah,
like,
neck down.
right?
Neck down. And I'm friends with all the facelift guys in town and all
Yeah.
the eye surgeons, and they refer me all their body work because there's
Yeah.
such an appreciation for the hyper specialization. Because we see the world through the same lens, and it's a narrow focused lens.
Yeah. Yeah. And you want to go to the person who's doing, and you do hundreds of them, right? Hundreds of liposuctions, or
Hundreds and
not
hundreds
liposuctions,
a year,
of
but
body a
it
year.
is pure love and joy. One of the nicest things patients always say to me when they, come in for a consult or they leave, their feedback is always, this guy loves what he does.
Yeah.
He's so interested in me and my operation, and that's because I truly am. Like, I actually love it. I wake up, like, jump out of bed at 4 a.m. I'm like, get me into an operating room and, like, let's go.
Let's go.
Because I have this amazing skill and I want to share it with this woman and the world.
So on that, can you quickly go through what is the difference between liposuction, a tummy tuck, and a mommy makeover?
Okay, so pregnancy, it causes changes to the body, like news flash. Okay, and this is the biggest paradigm shift I'm seeing. We are understanding now thin, fit women or get the most changes from pregnancy. There's the most amount of stretching. So it's paradoxical because you're probably thinking, like, if you're thin and fit, you'll just bounce right back. It's like not true, because you get stretched more.
Yeah.
And the laws of physics are the laws of physics. So when you have big babies, multiple big babies, twins, triplets, your body is physically stretched and torn. So the three main things that happen is the muscle separation, which is number one, the diastasis. That gives you the pooch, okay? That drives women nuts. When they are literally look pregnant and they haven't had a kid in 2 or 3 years, and those muscles are emailing each other, they are not texting or not talking, they are so far apart, there's nothing in the world that you could do. You could do a plank for a year, nothing's gonna happen. And then we come to the stretched skin. Now, loose skin on the surface doesn't seem like that's a problem, right? Maybe even seem frivolous. Loose skin, bunch of skin you can grab. But you know what's not frivolous? Not being able to wear a bathing suit, not wanting to go on vacation, not going on date night with your husband, you don't want to go to your child's bar mitzvah, bat mitzvah, or wedding because you can't put on clothes without wearing 65 contraptions, and the clothes you're wearing look ridiculous or frumpy, as they say. So it's not frivolous because it's a physical constraint. Loose skin, stretch muscles. You can never eat again and plank for a year, nothing's going to change. And fat gets deposited in stock. So when we're doing a tummy tuck, we're sculpting, that's lipo. We're doing a muscle repair and we're removing skin. And I can talk, and we will, we can get granular on how the tummy tucks have evolved.
Okay.
Because it evolves with the desires of the patients, right? Like, markets move where the demand is. So you have to change the procedure to the demand of the patient. And the patients we see in New York who come to my office, and they come from all over the world, it doesn't matter where they come from, they want the same thing. They want long, lean, and elegant. They want, when they're at a pool or whatever resort they're at in the world, or they're at their gym, they want people to look at them and say, she looks great, not she had great plastic surgery.
Right. Yes, that is so important. So really kind of just clearing this up, because I think that sometimes people listening might not know the difference, and they go to their doctor and they're like, I want liposuction, when really what they need is a little bit like you said. So liposuction is the simple removal of fat.
Here's
It's
the
not gonna,
two most
it's not
dangerous
gonna,
words.
yeah.
The
Oh,
two
tell me.
most dangerous words in plastic surgery. And I joke about this on social media all the time. And the number one revision procedure I do. Fit, thin women, doesn't matter if they're 35 or 65, go to their local plastic surgeon, they've had a couple kids, and they just say, I want a little bit of a little lipo. Plastic surgeon yes them to death because they want the case. Absolutely destroy their body. Period. Full stop. If, like, I don't know, say I do 600 to 700 cases a year, literally. The amount of women who had even one kid that I do pure lipo on out of 600 is maybe 2.
Right.
If you've been stretched, you have stretched tissues. Those tissues need to be removed, not cooked.
And I want to make sure we're not just focusing on pregnant women here, right? Because I feel like now, I mean, there's men who go in for tummy tucks, right? There, I mean,
Well,
there's
that's so
women.
funny
Listen, I've
because
had no baby, but I can't wait to come and see you to get this midsection done because I'm going to call it. I'm not a mommy makeover. Look, we age, the skin gets loose, and
I was
there's
just
nothing
about
you
to
can do
say.
about that, right?
Well, Liz, it's so funny you said that because I'm just doing an interview. I'm not going to say which magazine, and I think they're calling it, they always call my procedure the Birkin body, and they're calling it Birkin body without the baggage, meaning we're doing a lot of mommy makeover procedures for women who have never had children.
Yeah.
And it's because they have the same diagnosis. We're seeing a lot of skin laxity
Yep.
and looseness from women focusing on, exercise. Also, now you throw in all the GLP-1 agonists, the Ozempics and the this, you're getting people who used to lose 10 pounds, but now women in their mid 30s, mid 40s, mid 50s, even if they don't have children, you're adding a little bit of perimenopause. You throw in a month or two of Ozempic, you've lost 20 pounds. You have now completely switched from a liposuction to a skin removal patient. So you can call it whatever you want, but we do breast lifts and tummy tucks on patients. Probably a third of our patients don't have any children.
Right, right.
It's the Birkin body without the baggage. Not that the kids are baggage, best thing I've ever done, but it's a quirky name. But yeah,
So,
our
do
practice
you
is the
think
same procedure with or without the babies.
Do you think it's important then, for people who might be considering, really at the end of the day, if you are looking in the mirror and you're saying, my midsection bothers me, is it more important I guess what you're saying is it's important to go to your doctor and then have that consultation and not necessarily go in and say, I need lipo or I need
So,
a tummy tuck.
so we actually don't, we screen people on the phone saying, before you can meet me, are you willing to do the procedure the doctor suggests to get the results you desire?
Yeah.
And if they say no, we say, no problem, like go somewhere else.
Yeah. Yeah.
Because
yeah.
if you come in with loose skin and say, I want lipo, it's uncomfortable because you're like, well, it makes no sense. Okay. It's square peg, round hole, complete waste of time. And it'd be immoral and unethical to do it. So, but our patients know, and that's what we spread through social and our website, and patients share it themselves, which is an amazing new world where our full paying patients are happy to share their own experiences on social media, tag me, use their face, use their name, use their voice. Nobody cares about the scar. Nobody cares about the downtime, because when you get the body you want to live the life you deserve, nobody cares. Zero. 600 a year, 6,000 tummy tucks, zero. Literally, when they get the results they want, I get zero complaints about scar. Zero.
So let's talk a little bit about what that procedure is, so let's not focus on, I want to focus specifically for the
You
rest
want
of
to get
this
into some of the
episode
details?
on tummy tucks, right?
Okay, let's get into the details of an
Yeah.
operation. And this is what a patient, say someone's listening to this and they're looking what you should be looking for. Okay. This is how you want your tummy tuck to go. This should be like a 4 or 5 hour procedure. This is not a 90-minute procedure. You can't do this work in 90 minutes. This operation is 4 to 5 hours. This operation should be done in an accredited facility. I like the private, meaning someone's office, because you have your selected teams. We have better instruments, we have better people, and we're like a well-oiled machine. The other real specific detail about the safety of doing a tummy tuck, make sure there's 2 anesthesiologists in the office. Okay. I wouldn't go on a plane that had 1 pilot.
Good point.
So we always have 2 anesthesiologists. Listen, we have the benefit of having 2 operating rooms in my office, but have 2 around. God forbid there's a problem, have another set of hands. We don't have any issues. I always say you need blood thinners at your surgery and for the week after, because I can deal with bleeding, but I'm not dealing with a blood clot. Okay. Everyone walks in, everyone walks out. The details of the operation. The operation starts with lipo 360. Okay. You should get complete sculpting of the waist, back, armpits, lateral chest. All of that stubborn fat, it's got to go. It's got to go. To get those long, lean lines, the sculpting has to be done. We like Vaser. We do a lot of fat harvesting for breast and butt, injections, but it is complete sculpting. And that part of the operation should probably take 2 hours. Okay.
Yeah.
So if someone's doing 90-minute total, You're not doing the sculpting because you have to really turn the patient like rotisserie to get all the way around. Okay. And you want to use all the accoutrements. We're using Vaser, we're using J plasma, anything you can do to move the procedure a little farther. But really, it's the complete sculpting, taking that time. That's step one. That's the number 2 reason I see revisions is the patient didn't get the right lipo, or they just got a little. But like, I don't know. I play to win. Okay, we're gonna do
If you're
this.
gonna do it, go and do it. Yeah.
Like we're gonna do this. We're gonna do this. Okay, so after the lipo, we go to the muscle repair. So you make your incision. You're doing the muscle repair. The muscle repair is key. There's a million ways to do it, but basically you want to repair all the muscles that are separated. So, most people just do it down the middle, the rectus muscles, but really you can have multiple vectors. So I'm in there, especially these thin, fit women, petite from all over the world that have 3, 4, 5 kids. Their muscles, not just in the middle, but on the side are separated. Repair them all. Right. Repair them all. So you got to have the muscle repair is not like everyone gets the same. You want to have the lipo complete for your body. You want the muscle repair for your body. Skin removal. Okay, here's the details. The incision needs to be where the pubic area transitions to the skin. It should be under your C-section. And you make it as far as you have to get the result. The number 1 reason patients come to my office from all over the world for revision tummy tuck, the incision was not long enough, which means you didn't get enough of the stretched skin out, which, I mean, you just did that whole journey and you got like 70% of the results because you told the surgeon you didn't want the incision. There's no negotiating with me. Like I'm making the incision as long as I need to get the result that you want.
It's normally hip to hip, right? Like
I go way past the hip. We're way past the hip. That's hip to hip. Like you're missing 30%. That's a 7 out of 10. If you're not 3 to 4 inches past that on both sides, you're not a 9.5 to 9.8 out of 10.
So what does that look like? And
I mean, my patients wear string bikinis, so don't tell me the scar matters.
Got it. Okay. Now my next question for you is,
so why am I confident making a long scar? Right?
Yeah. Well, also, and maybe if you want to talk about that first, but you also do the reverse tummy tuck where they pull it up into.
But a lot of people are scared of scars. We show pictures all day long of scars on every skin type. So why am I not scared of scars? So when the skin is pulled down in a tummy tuck, they used to just pull it down, sew it up. But then all the force or strength or tension is on the stitches at the bottom. So now we do this very thorough thing called progressive tension, where when you pull the skin down, you're sewing the skin down to the muscles so that when it gets to the bottom, there's no tension. Then we're closing in 3 layers meticulously by the surgeon. It's not like the surgeon walks out of the room and someone else does it. The surgeon's doing it because you should care, because if it's worth doing, it's worth doing well. So you have, the meticulous 3-layer closure, progressive tension suture to take the tension off. And now we add a Prevena incisional management system, which increases blood flow. It's like being in a hyperbaric oxygen tank for a week.
Yeah.
And we have the patient post-op monitored, by our aftercare nurses and flexed, and you're bent over for 2 weeks. I mean, surgery with us is a huge downtime, but we get the results.
So let's talk about that. But before we do that, so we're talking about the tummy tuck, which involves, like you said, 360 lipo, the repair of the muscles, and and then the skin removal.
Yeah.
Now, what about people? So in general, with the tummy tuck, you're getting that total repair. How does that differ from
total torso
differ from a reverse tummy tuck?
So I probably do 2 or 3 a year again versus 600. So obviously we're in this. Usually the reverse is someone who had a mini tummy tuck done elsewhere. So from the belly button down, they're good. And it's just loose skin above the belly button.
Got it. Okay. And then that kind of pulls up into the breast.
Correct. But again, that is the exception, not the rule. And it's a fun operation pulling up, but it doesn't allow you to repair the muscles.
Right.
So it's a pure skin redraping above the belly button.
Gotcha. Okay. So let's talk recovery, because you just said 2 weeks of downtime, they're bent over.
Way more downtime. No.
Yeah. So
If you walk into a consultation, first of all, if you're not if you're not feeling the vibe with your doctor, like you should like them. Like I like to work with people I like that like the same things as me. Like, because this is a relationship that's as intense as any other relationship you're going to be in. So
You're literally putting your life in your surgeon's hands. So I don't care because
and the operation doesn't stop at when the knife goes down. The operation is basically going on forever. And like the first month, like I joke, it's dating. It's like, we basically see, I see you naked every day. And then, after like a month, it kind of trails off. Like,
it's like dating and marriage.
But it's but it's very intense. So you got to really vibe with the surgeon, and the surgeon's got to vibe with the patient, and the patient has to like the office, and the office has to like the patient. This has to be a big deal. If it's not a big deal, like it's not going to be a big deal for you.
Right. So what is that downtime?
So you have your operation in my office. You go into a recovery room, and then you're getting a private care nurse, because I don't care who your spouse, partner, or whoever is, they can't take care of you. They don't want to take care of you. We're going diapers. We're going leaking fluid that looks like a faucet. You have tubes coming out of everything. You can't go to the bathroom. You can't get up. You can't eat. You can't. You need full-time care. This is not send you home with a piece of paper from 1986 with instructions. This is an immersive experience. The way we do it is we want to say, hey, let's do this big operation, and then let's bring some hospitality and some razzle dazzle into it. So let's put you up in the plaza overlooking Central Park with your nurses, because you know what? There's no reason why your surgery can't be special. Obviously, not everyone needs to do that, but I do think the aftercare, specialized nursing makes a big difference. The first week, you are essentially completely useless to the world. Okay. You can't move. You are resting. You are flexed. Your job is to hydrate, take protein so you heal, and start lymphatic massages, and literally do nothing. You are not a caregiver. You are not the CEO. You are not this. You are not that. I have a ton of surgeons and lawyers. I'm like, you are not a surgeon this week. You are not a lawyer this week. The second week, you can start moving around, but you're moving around like a grandmother. You're bent over. We're getting your drains out. We're getting your incision management system off, but you're pretty useless to the world. From week 2 to week 6, you start regaining society. Okay. And when I say regain society, I mean, you are going for lunch, going for dinner. You are driving and going to activities back in the office, but you are moving slow. You are moving slow. It takes about 3 months to really start seeing results. That's when we're going to let you back into the gym. I mean, you're going to see results at 6 weeks, but at 3 months, you're going to start getting that wow factor. And then that's going to keep improving. And guess what? One thing people don't talk about, year 2 is better than year 1. Year 3 is better than year 2. Why? Because we take, people like you, Amber, people are dedicated to taking care of themselves. They enjoy eating clean. They enjoy exercising. Obviously, they all like to drink and stuff, but they enjoy taking care of themselves. But when we take away all the constraints on your body, it's again, compound growth. Like, imagine, you don't have, your muscles are where they're supposed to be. You don't have any extra skin. You don't have any extra fat. Do Pilates 4 times a week for 3 years, and like you'll look like you're 22 when you're 65.
Yeah. So on that, I think that we should address this now, because I saw a woman in her late 60s that you put on your social recently. So let's talk about age ranges. Now, of course, we know that every body is different, everybody's health.
Yeah.
But where do you find, that age range of
like
who's a good candidate?
I got just awesome people are a good candidate, but I just like working with good people. I got 2 silos. It's like the 35 to 45. These are younger women. They just had a bunch of kids kind of quickly, usually. They had 2 or 3, 4. This is kind of like the most common, actually, no, they're about 50-50. And they've literally in like a few years went from like this banging college body to like, they can't even look in the mirror anymore. And they're like, I'm not waiting. Let's go. Okay. And then so that's 35 to 45-year-old, a few kids, and they just don't want to live the rest of their life without they want to enjoy their life, and they don't want to there's nothing they can do. They've maxed out. They all do Pilates 7 days a week, never eat, so that's the first age group. Second is like my 50 plus, that's again, half of my patients. A lot of those are moms who are super busy, and they look pretty good after their kids and they were like happy. And then usually it's the menopause that really just added that extra stretch. The breast just deflated, the exercise is doing much less, and the skin just loosened up, and they're in their 55, 60, 65. They feel good because they take good care of themselves, and they look in the mirror and they're just like, who is this who is this woman? Because I don't look the way I feel. So we have that 35 to 45 and that kind of 55 to 70. I mean, I know this sounds odd. I do a lot of 65 to 7-year-old women because there's a lot of pretty awesome 65 to 7-year-old women walking around who don't feel like life is over, who have this incredible closet of clothing that they can't wear. And, they have the resources and they're like, and they're healthy. So like, let's do it. My oldest is 87.
You go down to Boca West, right? I mean, my family's in Boca and the people there are like, I mean, the women there in their 70s and 80s put me to shame, and I love it.
I probably operate on most of them. What was I gonna say? All they always say, the older patients, is why'd I wait? I should have done this when I was 35. Because they're like, you're telling me I could have had like from 35 to 65, I would have had this body.
Yeah. Okay.
So those are the two groups. It's like right after kids and kind of right after menopause.
Going into that recovery, and I want to dive into this a little bit more because, you talk about that first week, and when you say you're not going to be doing, I mean, anything, like you are basically bedridden.
You're a child. You need a baby nurse. Like someone has to like take care for you.
So do most people, have to get private nursing? I know that you offer that with yours, but again, we have a worldwide audience. So I'm trying to make this educational for people who might not be here in New York with you.
I mean, it's easier to have someone else take care of you.
Yeah.
Could someone take care of you? Yeah. I also like my operations are very, I don't want to say aggressive, but it's comprehensive. I mean, we push things, right? We're doing we're going definitely farther than most. We're comfortable because I do it every day. I mean, I really need a nurse managing and following blood pressure, heart rate, fluids. I would just not feel comfortable with the extent of operating I do, sending people off into the wild. And that's why, there is, tummy tuck light versions out there where they're in the operating room for 90 minutes and they have a little bit of lipo and they have a little bit of skin removal and they have a straightforward muscle repair and they're not flexed and bent over. And it's probably a lot safer to go home with, just a wrap around their stomach and call it a day.
But that's not
it's just not me. And by the way, that's probably fine and great for a lot of people and they're thrilled. I live my life a certain way and like I'm going a certain speed in a certain direction, and people who vibe with me and are moving at my speed and want the same things, they're signing up. Like I don't offer the light version. Like
so, keeping in mind this general, we're talking just to the general public here, right? Not your specific, but we have to focus on like what are some complications, like who's not a good candidate for this? And what are some of the negative things that people really need to be aware of when doing a surgery like this?
When not a good candidate. So it's usually a medical reason, right? Obviously, you're gonna have some people that you're just like, I don't really know if I want to be partners with this person on a project for the next few years because just personality issues. It's usually medical. The most common is BMI, meaning they need to lose weight because a lot of the mass that they're carrying is inside their stomach. So if you went to the operating room, I mean, when I say inside the stomach, visceral under the muscle. If you went to the operating room, you might be able to pull some skin off, but you won't be able to tighten the barrel or tighten the muscles because the inside of the barrel is full of fat. So you're not going to get a good result.
So what is that target BMI for tummy tuck? Because I know that's changed a lot from like the days of old with liposuction where they would just
listen. People are different in their kind of the way they do things. I would say under 30 is ideal. 32 is okay. 35 is too much.
Got it. Okay, and that's BMI.
Yeah.
Got it. Okay.
And remember, you got to take BMI with a grain of salt because if you have a power lifter and they're super dense, they probably have a BMI of 50, but they have a body fat of 0. So
okay.
Everything's got to be taken into context. That's again why you want to go to someone who does it all day, every day, because they're going to see around the corners. They're going to have the nuances down.
Right.
And then anytime you have surgery, there's always a risk of an anesthetic complication. So that's why I like to have 2 anesthesiologists around. If you somehow have some unpredictable, complicated airway, get a second hand in there.
Yeah.
Bleeding. That's usually a technical thing. But we do use blood thinners. Infection should be very low. It's definitely not going to be zero. And infections can be devastating, from a little bit of a skin redness needing an oral antibiotic to like, rare infections in the skin that cause tissue loss. Nothing great or amazing doesn't have risk. So, and blood clots, we give blood thinners after for a week. Some people do, some people don't. It's, seems to prevent blood clots in our patients.
Okay.
But when you're going into this, no, you're going to have nuisance. I think of complications, which are, significant problems are going to interfere with your life: infection, bleeding, blood clot. That's admission to the hospital time, really scary stuff. And then there are the nuisances, like you're going to bruise, you're going to ooze, you're going to be painful, and you're going to be swollen. That's not a complication. That just is. That's that's along for the ride.
Yeah, and you're going to be emotional. Listen, I've had surgery before, so I can tell you. One, I think that you never can. That most people underestimate what that downtime is. It's why I'm asking you to really go into it, because downtime to me was like, oh, I won't be able to go to the gym. It was like, no, I can't even I couldn't even sit up.
No, I tell
I had a
people for a
breast.
week you can't even go to the bathroom
by yourself.
Yeah, like that's how knocked out you are. And for a month, you don't feel normal.
Yeah.
In terms of the mental, it's funny you bring that up. I've written a blog recently. If anyone wants to check it out, it's on my site. But I tell people the first 3 weeks you're going to hate me, and then after you'll hate me, and then you'll love me for the rest of your life. But the first 3 weeks is like a psychological battle.
Oh
Because
yeah, and not only
you just paid this guy all this money. You were cut in half. You're bruised. You're swollen. Every part of you just looks gunky.
horrific.
And you're like, what did I do? And you always start getting did I really need to do this? I wasn't so bad. Why did I do this to
amen.
my kids, to my husband? All that goes away though. So
it goes away, but it's so important. I remind people, just don't forget, you're going to feel very sorry for yourself. And that is a natural part of having, but even if you had dental surgery, when you're in pain, you feel sorry for yourself. So if you do something like this, just mentally prepare that that's how you're going to be feeling. So if you're at a point in your life where where you're mentally not ready for this, make sure, before you do something, big on your body. Okay. So I want to be mindful of your time, because I know you are a busy, busy man. And we know that costs vary from where you are in the world to, specific surgeons, but can you give us ballparks for these types of things?
Yeah, listen, cost structures vary. Margins don't vary that much, which is an interesting concept, meaning like, say, for instance, something in my office is 80,000 and it's 20,000 down the street. You're not charging 4 times for the same everything. I think you're probably getting 400 times worth of, when you get into details, pricing, a lot of it is obviously, if you're going to be in Manhattan, the Upper East Side, just like commercial leases are going to be more expensive than Wichita, Kansas. Staffing, you want the best of the best. I mean, we recruit our nurses from around the country. Like like if you're in, Oklahoma, but you're amazing, you're moving here. We want the best, and we pay them the best. We have an all-star team, because I don't think you can do the work. You're going to be spending a lot more. You have a lot more resources. I have 15 full-time nurses who are dedicated. You have your cell phone numbers 24/7 for this.
Right. What are, can you kind of give ballpark? I know it's hard, but
no, I
ranges.
Can say, my guess is, the average for a tummy tuck nationwide is probably like 15 to 20,000, kind of all in. Soup to nuts, as they say in New York, which is like your anesthesia, your facility, and your surgeon. And I'm going to be 5-6 times that.
Right. Yeah.
But I think you're getting 100 times X the value. So I think it's a bargain.
Yeah. Well, I want to thank you so much. Dr. Neinstein, I feel like there's probably so many questions that are going to come in. I want to remind everybody at home, if you have questions you want me to pass on to him or his team, I'm always happy to do that. You can email me at hello@artbeautypodcast.com. If people want to come to see you, what's the best way to find you?
The best way is to go on our website and fill out a form, neinsteinplasticsurgery.com, and follow me and my associate surgeons, Dr. Chris Funderburg, Dr. Anna Steve, on social media. You will find us on the web.
Oh my gosh. And trust me, you want to check out his social media, because it's like the thing that I spend time Googling. I feel like you're my friend in my head. I know you. I know your kids. I mean, like, I certainly know your
So,
work.
so I know we're gonna take off. A lot of the times patients come in, Amber, like you, and they say, like, hey, like, I feel like I know you
Yeah.
because, because I do show my life. And I know a lot of people don't want to do that. But what that really does, it really filters, we're all trying to search through this world to find our people. And I show you who I am, and you're gonna line up with that.
Yeah.
Because if you don't like who I am and what I do, which is fine, then like you don't have to waste your time coming to see me.
Well, I was so pumped to have you on because I'm telling you, like I said, go check out that. I mean, it's like what I do. It's like my husband will be like, "Are you looking at Neinstein again?" And I'm like, "Oh my
Yes.
God, but look at
Yes, you
this.
did.
But look at this."
And by the way, I do it all. Nobody helps me, and we just show what we do. There's like nothing else to it. I don't know if there's any trick. Just show what you do. Be
Yes,
yourself.
I want to thank you so much for spending time with us here. Do you feel like we covered anything before I let you go? We kind of hit what it is, who it's good for, hit the risks, hit the costs, and certainly have highlighted a lot of the benefits. Anything else that you find that your patients really need to know before? Like,
I think all people should know that plastic surgery is a big deal. And if it doesn't seem like the office is making it a big deal, then it won't be a big deal to you. Look for an office and a surgeon that is obsessed, and the staff should all be smiling. Everyone should want to be there. It should smell nice. It should be inspiring. It should look great. If it looks like, your dental office from when you were a kid, that's the results you're going to get.
good point. I really like that. Yeah, you might want to make sure, take a look around, use those eyes.
Everything you see reflects the result.
I love
Period.
that.
Yeah.
I want to thank you again for being here. Thank you, everybody, for listening. I think we're going to have a great year together. Like I said, remember, you can email me questions at hello@rpdpodcast.com. You can find us on Facebook, Instagram, and right here on YouTube at RPD
Happy
Podcast.
New Year, everybody.
Happy New Year to you and yours, and we will see you next Tuesday. Bye.